Treating patients with recurrent pregnancy loss can be both very frustrating and very rewarding. These are patients who've had 2 or more miscarriages, and it's called recurrent pregnancy loss or recurrent miscarriages or habitual abortion. The reason it's so frustrating is even when we investigate these patients, we do a complete panel of tests. We often don't find any problem at all. The uterine cavity is normal, the chromosome study is normal, they don't have any hormonal imbalance, and of course these patients are extremely frustrated. Most of these patients are recurrent first trimester miscarriages, which means the miscarriage occurs at about 8 to 10 weeks and we aren't able to pinpoint the cause. Now, patients are very worried. When the doctor can't find the underlying problem, the diagnosis, how is he going to be able to treat it? And this, interestingly, is why the entire treatment is not based on finding a problem. The treatment is based on what is called empirical therapy, which is based on experience. And this is where the good news comes in. Studies have shown that even women who've had 3 and 4 and 5 recurrent miscarriages, again and again and again, if they don't lose heart and continue trying again, over 50% of them will go on to have a healthy baby with one single simple intervention, and that's called TLC or tender loving care. Now, this might seem amazing. I mean, how could just tender loving care make a difference to a pregnancy outcome, especially when someone has miscarried so many times? You would logically think, oh, if she has miscarried 3 times, then the 4th time the chances are going to be much higher of her miscarrying. But that's not true. And in fact, this is one of the reasons why any treatment for these patients, whether it's immune therapy, whether it's intravenous immunoglobulins, whether it's paternal lymphocyte immunization, whether it's, you name it, any therapy works so well because no therapy is required for most of these patients, which means the baseline success rate for these women, even if they did no other intervention, would still be 50%, which means even if they did something else, it would still remain 50%, which is great, which means half of them would go on to have a healthy baby. And guess what? They would give all the credit to the medical treatment, and the doctor would be more than happy to take this credit as well. So in short, though we often cannot pinpoint the reason for recurrent miscarriages, there's no reason to get disheartened. And if you continue remaining patient, your chances of having a healthy baby are extremely good, even though you might think that the odds are stacked against you. So please don't lose hope.